Hey everyone, Dr. Mark Fundino here with Davidson Chiropractic. Hope you're doing well on this Wednesday, hump day. I wanted to address a question I commonly get, especially over these past couple weeks from patients. And that question is, I'm not sure if I should keep doing my corrective exercise program that you've given me because I'm noticing some increased symptoms or let's call it pain, at you will. So my response to them is first, well, when you're performing those corrective exercises for your neck or low back or shoulder, whatever the condition might be, are you experiencing the same complaint that brought you into my office, or is it something different? So that's my first question. Are we dealing with the same alarming or chief complaint that brought you in that we were trying to address, number one? And if it is, as long as the pain level on a 0 to 10 point scale, 10 being the most severe pain, is maybe a mild level, like a 3, no more than a 3, then I'd say let's work through those exercises. Now, if you're noticing 6 hours, 8 hours, or a day later that you're really exacerbated, meaning now your pain had been like a 4 and now it's up to a 6 or 7, then we need to look at those corrective exercises and to see if there may be something we need to change in there. Maybe you're performing them incorrectly. Maybe that's not a good move at this time for you. You're not ready for that corrective exercise progression, so we might have to regress a little bit. And then the other question I ask patients after they tell me they're noticing some discomfort with their program is, all right, again, is it the same pain that brought you into my clinic initially, or is it something different? Are you noticing more like soreness, fatigue, like the muscles are being worked? Because if that's the case, it could just mean that those muscles are deconditioned, most likely. They're not used to being worked in this manner. Again, so if the discomfort in that scenario is only a 3 or 4 on a pain scale or discomfort scale, I might say let's work through those, okay? Let's keep moving along. Because that brings us into the third scenario where we get some fear avoidance of moving, like some kinesiophobia, where as a patient has a low back disorder or a neck disorder, and they've been guarding their spine for so long, as we start initiating new movements or get them working different ranges, there's this psychological component that, hey, if I move in a certain way, I'm going to do more damage or I'm going to make my condition worse, where we know if we can get you moving properly and doing your corrective exercise program that the condition actually may improve. So also, if you're doing those exercises, initially it might be a little sore, but as you go through the program, even at that time, you might notice the discomfort easing and actually you feel better. And we're trying to empower you to give you the tools so that you have some tools or things at your disposal that you can help manage your own spinal condition and not always rely on myself, massage therapy. Not that we don't want to use those things to be preventative, but we want to give you things that you can do to empower you to live the life you want to live without taking drugs, without having surgery or having to get any type of spinal injections. So if you guys have any questions about exercise, reply, give me a little comment below in the YouTube comment section, or if this happens to be on an email, just reply to this email and we'll definitely answer those for you. Otherwise, have a great day and hope you have a great end to your week. Take care.